And sleep disordered breathing, we can go into the details of what that is, but it's basically your airways collapsing at night. And this ranges from upper airway resistance syndrome, which is basically snoring, to obstructive sleep apnea, severe obstructive sleep apnea, where literally the airway is being shut off when you're sleeping. So you're not breathing, and then the body's not going to try not to let you suffocate. So it'll wake you up. It'll basically, your body will do basically an adrenaline shot to wake you up, release all these stress hormones to open up the airway. And this goes on all night long, every night, night after night, day after day, decade after decade. So I would treat patients sleep apnea with these oral devices, and I very much enjoy that this niche area of dentistry. For one, someone that has sleep apnea, they go 5 to 10 years without a diagnosis generally, and so they get their first real night of sleep in a decade, and they see the results like that. They feel like a new person. So it's a rewarding area of dentistry.
Other species don't have mouths with crooked, crowded, impacted teeth, fillings, embedded, inflamed gingivitis, fatty tongue, and narrow airways that is causing, you don't see a chipmunk snoring.
And these things are all related. Cavities, periodontal disease, fatty tongue is what I call it. They're all diet-related diseases that manifest in the mouth. And they are so common that we tend to think they're normal. For example, it's very much the norm for kids. I do pediatric dentistry as well. For kids to have cavities, so normal that it's just another, you go to the dentist, oh, you got cavities, we do some fillings, etc., and you go on. I like to say it's the canary in the coal mine often, where if your teeth are rotting, literally the hardest substance in your body, tooth enamel, is being rotten away because of what you're eating. I think it's a pretty good indication that what you're eating is not appropriate. Dentists, I think they have we get some of the earliest warning signs that are often ignored, because I'll see a kid with cavities and they're 6 years old, where, they go to the pediatrician gives them a clean bill of health. They're like, you're yay tall, you're developing more or less fine, you don't have any diseases. Okay, you're fine. But the mouth tells a different story. And often those problems that I see in the mouth will later manifest as diabetes, obesity, metabolic syndrome, and the sequela of negative impacts that relate from that, like obstructive sleep apnea as well.
Yeah, I'd have to say, I'm sure you've never seen a mouth full of oral dyshealth and have it be attached to a healthy person. Just doesn't happen. So likewise here with the ocular evidence that I was presenting here, other species are not going blind from eye diseases. There's, aside from maybe trauma or injury, you don't have blind squirrels. And without the ability to see, we really lose the ability to hunt for food. And ultimately, you'd starve or go extinct. It's another reason to believe our ancestral diet is really what is here to keep us to evolve and be healthy. So here I have on the top the lovely, beautiful, healthy mouth. And then below, what goes on with gingivitis, crooked teeth, that we can see how disordered this mouth is. And then I have a picture here of a healthy eye. And right below it, the cataract that has formed, where somebody really can't see through that. And then the healthy retina up on top. And then below, this is a sign of all sorts of, diabetic retinopathy, hypertensive retinopathy, all sorts of retinal vein occlusions. There's so many disorders that stem from our health, our general health. So again, this is sort of a similar situation where I don't see anybody with eyes looking like that have a healthy body attached to them. And with cataracts being the leading cause of blindness, and everybody says, well, it's just a disease of being old. Well, guess what? Look at some of these statistics. Look how the prevalence of cataracts is increasing, 129% from 1990 to 2019. So in about 30 years. And in China, the increase was even as high as 223%. This is not an increase in elderly people. This is a change in our diets. And the increase in cataracts cannot be attributed just to the general trend of getting old.
Periodontal disease is a big one. So 47% of US adults in the United States have periodontal disease. And periodontal disease is gum disease, where the bone that holds your teeth in is being eaten away. So it's a chronic disease that is I mean, it's pretty like when you put it like that, people are a little startled. They're like, oh, bacteria are eating away at the bone that are holding my teeth in. And nearly 50% of people and adults in the United States have it. And there is a mountain of research that connects periodontal disease with almost every single chronic disease you can think of. And so much so, the associations are so strong that people would thought that the periodontal disease was causing these other diseases. Now, I think it might play a role in exacerbating some of these things. I just think they're more likely that we have a common root cause of mainly like a poor diet that is both leading to periodontal disease and this, myriad of other chronic diseases.
So, and we can get into here, the key for root cause prevention really ultimately comes down to limiting the carbs, limiting the refined grains and sugars, and those dang nasty, toxic, poisonous seed oils, which are, have such a long half-life that you eat a French fry today, it'll still be there 4 years. It's that serious, and it's just a very slow suicide. And
Yeah, so I think a lot of similarities here with the eyes and the teeth is a lot of people think it's just genetics, right? And they just pawn everything off to genetics. I got crooked teeth, it's genetics. I got sleep apnea, it's genetics. I got cavities, it's genetics. I got passed on from my parents. Genetics play a role in everything, obviously. Epigenetics play a significant role in things as well. But here, so the first kind of picture at the top left is a skeleton. It's a good example. It's an older skeleton, no cavities, all 32 teeth fit in. They came in straight, no abscesses, no impactions. And this was the norm prior to the agricultural revolution. The bottom middle one is from Dr. Weston A. Price, who are people not familiar with. He was a dentist in the earlier 20th century, traveled the world at a unique time in history where we had airplanes, we had the photography, and we had the intersection of traditional indigenous diets and the modernization of diets, notably lots of refined grains and sugars. And so he traveled the world and he basically studied populations right next to each other. One population eating a traditional diet, another population with modern food. Those people that were eating mostly their traditional diet, they overall had healthy mouths and healthy bodies. And when the displacing foods of modern commerce came in, they rapidly got cavities. The first generation got cavities right away. Second generation not only got cavities, but they also developed malocclusion. So, I mean, the theory of like, it's just genetics, Dr. Weston Price did a lot to kind of disprove that theory all by himself.
And then here you have the shrinking palate. So many kids have to wear palate expanders. And
yeah. And when it comes to malocclusion like this with a vaulted palate, and I see this, it's almost the norm now, unfortunately. Growing your face is kind of like growing a muscle. If you want to grow a muscle, you need proper nutrition and you also need the proper stresses of that muscle. If you just eat well, but you don't move the muscle at all, it's not going to grow as it should. If you move the muscle, but you don't have the right nutrition, it also is not going to optimally develop. And so our faces, notably the maxilla and the mandible, the maxilla is the top jaw, the mandible is the bottom jaw. And many people, myself included, are underdeveloped. And a root cause issue of that is malnutrition, meaning we're not eating enough meat mostly, and we're also not chewing enough. So we're not chewing enough meat. Breastfeeding versus bottle feeding also plays a big role in this. And because of various dynamics in play here, it often will lead to mouth breathing, which will exacerbate the whole issue.
It's interesting looking that picture right there with the soft palate. That child clearly can't lay the tongue up onto that palate like they're supposed to.
So we have the top jaw and the bottom jaw, and we need them to basically fully develop. And if they don't, we have 32 teeth that are trying to come in, but there's not enough room for them all to come in. So they start just coming in wherever they can. And that's what leads to crooked teeth in a majority of the cases.
So poor diet doesn't give us the needed nutrients to properly develop our jaws. Then the teeth don't.
From a child health perspective, I would have the main course be meat mostly, and you eat that first. Okay. And then as long as we get that down, you are ahead of 99% of people. The second thing I would talk about is for parents, mental state is all the kids I'm around is all they talk about is snacks. When's the next snack? When's this? When this? And it leads to behavior issues and conversations like they don't want to eat the rest of their dinner because they know the sugar's coming after. Set a line in the sand and be like, all right, if we're going to have desserts, we have it on this day at this time in these foods. So it's not just a constant battle. So kind
And
of
it,
the two
it could
things.
it could be something as delicious as you can take ricotta cheese or cottage cheese and put a scoop of chocolate protein or strawberry protein, which is amazing. But just take an immersion blender and whip that and throw it in little custard containers. And it really is like a very nutritious, healthy dessert.
Children have immense growth demands, but they don't eat immense amounts of food yet. So they need to make every bite count. And I think if parents have that in mind, they're like, okay, we need to get the most nutrient dense food into your belly first. So that's mostly going to be the red meat. It's going to be eggs. It could be some dairy, but it's going to be like animal products. You could throw some other plant products in there too on top of that. So great question. I am a big advocate of mouth taping to train nasal breathing. Now, I always give a caveat here is if someone has some form of airway obstruction, like upper airway resistance syndrome, which is kind of like, just think of that as snoring, to sleep apnea, mouth tape can help improve to some degree, but it is not a recommended treatment option, especially for sleep apnea. Like mouth tape for sleep apnea, and you can't, like, if you get a diagnosis and a prescription, they will never prescribe mouth tape because it's not used to treat sleep apnea. I've never seen any research to really say, hey, this is an effective sleep apnea treatment. EPAP device, on the other hand, has been studied, and if you got a diagnosis and a prescription for sleep apnea and an EPAP device, you can use that to treat various levels of sleep apnea, like mild forms of sleep apnea. So I'm a fan of mouth taping as long as it is not to mask an underlying problem of airway obstruction. I am right on board with you. So my biggest concerns with fluoride is with developing children. An adult that is using fluoridated toothpaste and spitting it out, there are some risk there, but it's like pales in comparison to young children drinking fluoridated water day in and day out, doing high concentration fluoride varnishes, rinses, toothpaste, swallowing this, because the research is, I mean, there is an ever growing body of research showing how this fluoride consumption during development very negatively impacts the brain and is neurotoxic and is almost on par with lead as far as drops in IQ in children in many studies. 5 IQ points it seems to be almost like kind of like the baseline. And to me, the risk of getting some cavities, and we can talk about that as well, pales in comparison to like damaging a brain for lifelong. Like I could fix a cavity in a couple minutes. Like I can't fix that brain. Even the research, like one of the largest studies ever done with regard to this, showed that fluoridated water in particular might reduce the incidence of cavities by 1 surface cavity. Just to give you a perspective, if there's a surface cavity on a pediatric tooth, I can literally fix that in like 5 minutes. So to me, it's not worth
the risk to the not irreplaceable brain tissue.
Exactly. And there's other risks. Thyroid risk with fluoride, it can compete with iodine for uptake in the thyroid, so it can lead to hypothyroidism. We see communities that have fluoridated water have higher rates of hypothyroidism, kidney issues, bone issues.